Hi, so welcome everybody to the Step Therapy for Migraine Other Headache Disorders webinar. My name is Shoshana Lipson from Migraine Meanderings, and I'm here with Lindsay Videnieks. Hoping I'm pronouncing your name correctly. I should have that right by now. Thank you. This is a project that we have partnered on together, and we're very excited today to be sharing the results of the survey that we co-branded. But we're going to start out with a definition for step therapy, and I'm going to hand that over to Lindsay for that.
Sure. I just want to welcome everyone who's still popping into the webinar. I think I'm still seeing those numbers go up. So thank you for sharing your time. This is an important topic. Just to frame out, Shoshana and I have developed this series on essentially utilization management barriers or issues to optimal treatment and care for migraine patients. And this is the fourth in a four-part series for now. But we wanted to level set before we get started on this topic, just to make sure that that we're reaching everyone who's joining today, wherever they are in terms of their knowledge about the topic. So, I wanted to define step therapy for this group. It is largely a quote unquote cost containment process, but really it's when insurers, either public or private, because we know CMS uses this protocol as well, requires patients to take one or more alternative medications before they can access the actual therapy that their provider has prescribed. So this is supposed to be done in an attempt to control healthcare costs, but we're seeing it increasingly applied to patients with sort of little regard for their medical situation or treatment history. It has been sort of a blanket approach. And so I think that the aim of this survey was to capture some very recent data during the month of February of this year for migraine patients and how they're experiencing it in real life. So that's just a quick level set before we get started.
Absolutely.
And so let's just jump to who we are, what we do. Nice to meet everyone. Lindsay Videnieks, for those who don't know, I'm Executive Director of the Headache and Migraine Policy Forum. And our group is a 501c4 coalition group that is comprised of about 24 stakeholder members. We're happy that Migraine Meanderings is a member, but we really try to take a quarterback approach for the community on a lot of these policy issues, in particular that relate to utilization management protocols. So, and then try to advance public policies and practices that improve patient access.
Yeah, absolutely. Thank you, Lindsay. And again, my name is Shoshana Lipson. I'm the Executive Director of Migraine Meanderings, which is the DBA of Hope and Pain, a 501c3 registered charity. And our mission is to provide patient-oriented resources, encouragement, support, and education for people who live with migraine, to raise awareness about this disease, and also to empower patient voices. And part of empowering patient voices is encouraging people to speak up about the things that we need to see change for, about the challenges. And of course, one of these areas that we need to see change in is with step therapy. And so it's always a privilege to partner with Lindsay and HMPF and to work together on projects like this to bring about change.
Thank you, Shoshana. So let's get started. We talked about this survey took place during the month of February, as I mentioned, and we call it step therapy. You probably also heard the phrase fail first. And, because language matters, we also want to make sure you know that, these are therapies that have failed the patient. This is not patients failing on a therapy. So I think I want to make that very clear. But for the purposes of this survey, because of Shoshana's amazing group that she organizes online, we had well over 400 people join just during the month of February. And so we captured some of these demographics. It should be of no surprise to this audience that 96% of the respondents were female. The age group, again, right in the central sort of heart of the time frame that migraine afflicts folks, which is between the ages of 26 and 55. And then the majority of the respondents were covered by commercial insurance, with some from Medicare and Medicaid. And the frequency of headache for this cohort of respondents was actually pretty significant. So a lot of folks in the chronic migraine category. So in 15 to 30 days a month, 62% is a very high number. So what's interesting is that as you move through the data, keep that in mind, because the folks who are experiencing step therapy or fail first are those that are perhaps the most hard hit by the disease. Next slide. Background. So 100% everyone who responded to this survey had been prescribed a medication or medical device. And I think it's an important note that they had been prescribed, in some cases, a device. We'll talk a little bit about how that kind of skews the data later. But 93% report that their insurance did require, that's literally almost everyone, to follow step therapy prior to approving a medication. And so 77% say insurance refused to cover that initially prescribed medication, and 27% were refused device coverage. So that there's a little notation there that says explain, because for many patients, you know, they actually don't even ask their insurance companies for coverage. That's not even something that they know they can do. And so I think Shoshana is also part of a larger effort, her organization, to make sure that greater awareness about device coverage and the availability of devices is something that we're trying to do as a community. And then for this survey, 44% reported that their insurance did end up covering their medication, but with very high copays, which could make it out of reach. Next slide. And so this is sort of descending order of the type of step therapy that was imposed on patients, depending upon what their clinician had prescribed. So top of the list, those would be patients that have been prescribed an injectable oral CGRP inhibitor. Second would be a neurotoxin like Botox. And then from there on, a brand name triptan, then an infused CGRP inhibitor, and then finally devices or other. Next slide. So the question of what is reasonable versus onerous step therapy, for those of you on the call that have gone through the ICER process, and for larger groups that have formed consensus statements about, what's sort of in the norm for patients to expect or experience with regard to how many medications they have to try before they can get, the one that their doctor prescribed. So 39% said 1 to 2 medications. Again, as a community, we don't find that to be unreasonable. But the more troubling number was that 42%, 3 to 5 medications. That's a very high number, because those number of medications all have a time and lifespan in between when they are trial and errored. And so you think about migraine being a progressive disease, and one where sort of you're on the clock in terms of, if you're not managing it well, it can cascade. And so if you can imagine having to try 3 to 5 medications that your doctor did not prescribe for you, but that your insurer is saying you have to fail, or that will not work for you, can result in many months of a burden, pain, and not having access to care and treatment. So, and then finally, 7% experienced 6 to 9, and 3% actually 10 or more medications, which is just a kind of a wild number. Next slide. The wait times. This is what I was just mentioning, which is how often or how long do folks have to wait in between? As I mentioned, depending upon how many therapies they had to step through. 32% said the average for them was 2 to 6 months, but 14% said, and I believe that should probably be not 36 to 11, but almost a year. So that's basically waiting a full year before, when your doctor said that you could be prescribed a certain medication, having to wait almost a year to receive it. And then 11% said 1 year or more, and 11% never even got the treatment that they were prescribed. Next slide. So the steps, the different types of different types of therapies that a patient might have to step through. So 22% had to try over-the-counter pain medications. 59%, and this is not a surprise, stepped through with triptans, probably 1 or 2. 61% had to take an anti-epileptic therapy, 54% a tricyclic antidepressant, 15% injections of a neurotoxin, and then 31% says other. And I don't remember, Shoshana, in the survey if we had them, if the survey response had an opportunity to sort of, say which other therapies that they were asked to try. But
I think we did give them the opportunity for that, and also just for the opportunity for general comments. So sometimes it's that the insurance company wasn't specific, as in you have to do an anti-epileptic or you have to do a tricyclic, but you have to do 3 out of the following classes or 4 out of the following classes. And then they included anti-epileptics, antidepressants, and some other ones as well, some of them which there is much less evidence on too. So
right, exactly. Okay, next slide. I think this is where I turn it over to you, Shoshana.
Okay, that sounds great. So dealing with insurance appeals. I know that in my group, this is something that we really encourage our attendees, our community members to do. It's part of being an empowered and an educated patient. I always tell people in my groups, it's not fair, but it is what it is. We have to do it. And so I was super encouraged to see 46% of respondents to this survey had called or written a letter to their insurance companies to appeal the requirements themselves. Now, again, have to bear in mind that this is overall a more educated group of people than you would find in the general migraine population. It's not only people from my community, but people from other CHAMP participant organizations, communities, but still, I thought that was very encouraging. And I honestly expected it would be fewer. Obviously, we want to encourage that to be higher and to provide resources to make that easy for patients, a sample letter that they can write or a sample script on a phone call that they can say. Just even knowing that they are allowed to do that is huge. What I found most discouraging here is where it says 60% of respondents, HCPs, sent a letter and or called insurance or contacted the insurance to appeal the step therapy requirements. That should be, in my opinion, 100%. If a medication is denied, if step therapy is required, then the HCP should be responding. Now, we don't know if it's that they did respond and patients weren't aware that they responded. That may be the case in some of the situations. However, we do know, obviously, from HCPs that there is a huge burden to deal with prior authorizations and to do appeals. And so it can be challenging on their end as well. But obviously, this is a problem that only 60% are reporting that HCP sent a letter, which is why some patients end up never getting the medications that are being prescribed for them. And so that was disappointing and maybe an area of focus for us. I also want to note at this point, if you have questions, please put them in the chat, in the questions, and Lindsay and I will get to them as soon as we can. So next slide, please. Can we go to the next slide? Oh, there we go. We are on the next slide. Beg your pardon. So the impact of step therapy. So it's no surprise, bearing in mind everything we've looked at so far, that the impact of step therapy can be huge. And what we asked here was, during the time respondents were taking the insurance required medications, how did it impact their quality of life? And we know that increasingly quality of life is something that is being looked at for people who live with chronic diseases such as migraine, other headache disorders, although it can be very challenging to quantify. So 57% said that they had migraine attacks more frequently. 24% developed new or additional migraine symptoms. That could be that they went into status migrainosus or something else going on. We know that when people have extended migraine attacks, they can have new symptoms or just worsening the symptoms. 41% here developed more severe migraine attacks, because we know that migraine is a progressive disease. And so when it is not managed optimally, we are more at risk to get more severe and more frequent migraine attacks. And then this is the one that, to my mind, should be a no-brainer for payers, and that is that 31% had to go to the emergency room or urgent care for one or more migraine attacks. So when patients find that their migraine attacks are not treated optimally or effectively, a lot of the time they will end up in the emergency room. And we know not only is that a huge cost to payers and a burden on the healthcare system, but it's also generally a terrible situation for people who live with migraine. The last place you want to be at when you have a migraine attack is in the emergency room or even in urgent care. So this is obviously part of the impact of step therapy, and it's very concerning. Next slide, please. So here we see that 89% of the respondents said that the inability to access the treatment they need has impacted their ability to manage their migraine. Just to follow on from the last slide, 74% said it's led to their disease worsening, so it is chronified. 89% agree it has negatively impacted their quality of life. That's not just their physical quality of life, but also the emotional and mental well-being for their quality of life. 72% says it has negatively impacted their work and career. Again, I think that that is really a no-brainer. If you're not able to have your migraine attacks managed effectively, it's very, very challenging to work the way that you did. Then you're looking at presenteeism and absenteeism. And 30% agree it has negatively impacted their education. And that's a little bit more challenging to quantify again, because a lot of the times it's not reported. People don't say, hey, I didn't do so well on a test because of I had a migraine attack. And so it's just a challenging thing, but the impact is huge on education. And we do know that. So the next slide, please. Patient feedback. And just before I get into this, I'm just going to note that one of the things that a lot of patients don't realize is that some insurance companies, maybe all, you can correct me if I'm wrong, Lindsay, they have a 72-hour turnaround time for prior authorizations. Is that correct for all insurance, or is it just for some insurance?
Well, it's kind of state by state. So where there's prior authorization reform, they've, some states have done a great job saying, look, you got to turn this around in 24 hours. But typically what you're describing is the norm. Sometimes it can be longer, which is
right. Interesting. So I think that kind of speaks to the fact that it's important for us to know, like I know with my insurance, the turnaround time is 72 hours. And what I found out the hard way is that it's not 72 business hours, it's just 72 hours. So if your doctor puts in a PA appeal on Friday and the insurance company gets back to them immediately and saying, hey, we need this and this additional information, and your doctor does not get back to them until Tuesday, then they may have missed that 72-hour window and the appeal automatically gets declined. And so it's very important for patients to know what the time frame is, and also to remind your doctor's office, hey, has this been followed up on? It's okay to be a squeaky wheel. I talk a lot about being a squeaky wheel, probably because I am. But I will say that because I'm a squeaky wheel, I have 100% success rate in having medications approved, but sometimes it's a really long fight and it is absolutely exhausting. So I don't want to minimize that at all. And it's not something that any patient should have to go through. And I think for those of us who do appeal, we go through these phases of, okay, I'm just exhausted. I don't want to do this anymore. And then our health suffers. So this is some of the patient feedback that we got. During the waiting period, my migraine went from episodic to chronic, still dealing with insurance. It has been years. Also dealing with copay cards and unexpected bills worth $40,000 for things insurance mistakenly covered. So I don't even know what to say about that because it's just so shocking. Lindsay, is this something that you've seen where insurance companies come back and say that something was mistakenly covered?
I think that absolutely does occur. And so, I think that for patients, it just leads to a lot of confusion. It is not a certain situation. It's not meant, and I will say kind of baked into this process is confusion. And so the more we have opportunities like this to talk about, I think that folks can understand sort of how the process works.
Right, absolutely. Sounds good. And I see that as a comment here from Michelle saying that she was told by insurance she had to try all 7 triptans before they would approve Ubrelvy, which is a CGRP oral inhibitor. And she tried 3 and then started writing letters. And that's just, it's really shocking. And we also hear from people who say they've already tried treatments, but it's not necessarily on their medical records if they moved. And so that they have to try to get those medical records over to their current doctor, and their current doctor add it to their current record. It's just, it can be a mess. So the next person says step therapy is barbaric. And contributors.
Well, and just to add on to what Shoshana just mentioned, we had a participant, Michelle, as she mentioned, talk about how she had to, she was told to try 7 triptans. She went through 3, But then Michelle turned to advocacy. So she became an advocate. She wrote letters, she said, to all of her congressional delegation, her state delegation, and also the governor. She said the governor forwarded her email to her state Department of Insurance, and they filed a complaint on her behalf against her insurance. So that is an important tool where there's a systemic issue, or I would say in just sort of egregious, requiring someone to try 7 triptans before they could get, in this case, Ubrelvy approved is outrageous. So I will ask my colleague Elise to share the link into the chat box where it will directly link to every state portal, no matter where you live in the country, where you can file an insurance complaint that will go to your state's health insurance commissioner and their Division of Consumer Affairs. And those folks sort of act as an intermediary between you and the insurer if there's this sort of outrageous systemic issue like it was in the case for Michelle. So I believe that Elise is going to pop that into the chat during this session for everyone to click through.
Fabulous. Thank you so much for that. It's so important to have these resources. And I think that's a great example of step therapy being barbaric and contributing significantly to the worsening of the disease. It's just really, it's so unacceptable. The only good thing that really comes out of that is that a lot of us end up as patient advocates and, working towards change. And again, emphasize it's not fair, it's not right, but together we can use our voices to bring about change. The next person said step therapy imposed by the insurance company is a conflict of interest and an interruption of the relationship between the doctor and the patient who know better what the patient needs. And it's interesting, there's actually a doctor who's doing some reels on Facebook I've been watching recently. And this morning I saw one where he's going on and dealing specifically with prior authorization process and suggesting that the insurance companies are practicing medicine by interfering in the doctor-patient relationship and making medical decisions for that patient. Lindsay, do you want to say anything about that?
Yeah, I mean, I think that especially for migraine patients where it takes a long time to develop a trusted relationship, there's a lot of providers we hear from that just say, look, I'm the bad guy in some ways that, my patient's frustrated and upset and they'll call my office because they're either having to deal with paperwork or these denials or having to go through this utilization management barrier issues. And so, that can be destructive. That can kind of over time tear down a relationship when it's honestly the one person who's trying to be very helpful to the patient. So that is what we call the creepy third person in the room. You're in the office visit with your doctor, and there's somehow this invisible insurer kind of in the room as well. So it absolutely can have an effect on that relationship.
Yeah, absolutely. Next slide, please. And just to emphasize that the person making the decision, the insurance company, is often not a doctor. So just want to note that patients often don't realize that. There was a link just shared in the chat for those who need that. And we can also include that in an email, maybe.
Yeah, we'll put in an email. I'm unable to share it as I'm a host. I can't share it with the entire audience, but if someone else can share it, that would be helpful. We'll do that during the session.
Yeah, it looks like Elise just put it in, but for those who can't access it, I saw from someone that they couldn't get that. Okay. So the next person says, extremely frustrating to pay your insurance premiums and then have to struggle and fight for medications you need. Absolutely. Another one, this is a very common situation. They went through all the hoops and times to get the medication approved, only to discover their copay was going to be $650 a month. And I think early on when Lindsay talked about copays often being very expensive, even if you get approved after step therapy process. By expensive, someone may think, oh, that means $50 or $75 or $100. No, for migraine medications, we're often looking $500, $600 upwards. Sometimes I've seen even as high as $1,000. It's basically like it's almost not a copay. And I don't know any patient that can really afford to pay this amount for medication you need every single month. So just going to emphasize that this is not medication that you're just going to need once a year. This for many patients is every single month, in addition to multiple other medications that you need every month. And it becomes just unfeasible for them to pay this. It's not right. The next person talks about the emotional impact of it, which is huge. They say they'll bounce back from the worst of their physical health, but the mental and emotional challenges and the scars are huge. And I think that we would be remiss not to note that. We know that anxiety and depression are comorbid with migraine. We know there is a bidirectional flow with that. It's not just that one only causes the other, but it goes both directions. And so this is a significant thing for us to also bear in mind, is the emotional impact of trying to fight an insurance company that you just don't know how to fight, and it's exhausting. Next slide, please.
And Shoshana, just to piggyback on that, that adds costs to the system as well, because if you're not well managing your migraine disease and you get further depressed, that may add additional doctor's visits or scripts related to that comorbid condition. So it really is a lose-lose.
Yes, absolutely. Or more emergency room visits. And by the way, more emergency room visits are not only not optimal, they're often very traumatic, especially if you end up with a doctor or healthcare professionals who do not understand migraine. I myself have had nightmare. In fact, every single emergency room trip I've had for migraine has been a nightmare. I am absolutely traumatized by it. And I have a total fear of ever going to the emergency room now because of that. And I know that I'm not alone in that either. Next person says the use of any treatment, again, should be a decision made jointly by the patient and the physician without interference by the insurance company. Next person, step therapy is awful. And this is one of the points I made earlier, especially when I've already tried the medications that the insurance company wants me to try, but you're trying to get documentations from previous doctors, maybe from out of state. If you didn't get them quickly enough, then the statute of limitations may have expired and you may not be able to get those records. It can be very, very challenging, not only frustrating if you're being tried, if they're wanting you to try medications you've already tried that didn't work, but now if you've got medications that are actually causing serious side effects, now you have a serious medical issue. And that's something that is a big concern.
And Shoshana, I would also add, for everyone on this webinar who lives with migraine disease or headache disorder, there's the uncertainty of not knowing when you'll be down, right? So when are you going to be well enough to collect all of this paperwork or make those phone calls? It's all respect to our friends who have cardiovascular disease or live with other diseases that are very serious as well. But you can kind of plan your life and be able to make those phone calls. Or for migraine patients, they are already living in a very sort of unstable or uncertain environment in many cases. So it's hard to plan to be on top of all of this. And so it's an extra burden that way.
Right, absolutely. And I think next slide, which probably brings us to our Q&A. I don't see any outstanding questions in the Q&A section or in the chat, but if anybody does, please let us know. Just to let you know that we have the opportunity, HMPF and Migraine Meanderings, to take this project that we've been working on and take it to the next steps. We're exploring options for that right now, and we'll let you all know about that when we know more. And I know that Lindsay, you're also going to be taking some of this information and presenting a report to ISA. Maybe you just want to mention that.
Yeah, so as part of this series, because this is the fourth part in a series, we had one survey and webinar each on ER usage, combination therapy, device access, and then of course step therapy. We plan to package all of this into a report and then provide it to policymakers. That could be ISA, it could be the National Association of Insurance Commissioners, any other sort of interested stakeholders who have a decision-making authority, so they can better understand sort of an up-to-date, very recent information affecting probably a significant portion of their constituents.
Right, absolutely. And also I think we should note that we are exploring topics for another survey later this year. We don't want to do a survey just for the sake of doing a survey, but there are some very important topics that I think we still need to cover. And so we will be coming back to you shortly with information on that once we have looked at all the different options and seen what is the highest priority. So I see that Sarah asked where you can view the other 3 parts of the series. So we have the YouTube recordings of these webinars on both HMPF YouTube channel and Migraine Meanderings YouTube channel. So you can see that. I know on our website, migrainemeanderings.com, you can actually go and look at all the surveys. We have summary reports that may be helpful for you too, where just like a one or 2 pages, you can see some of those stats and that data. And I know, Lindsay, you have it on your website as well, right?
We do. And I think, after this call, we send out the recording to everyone who's joined today. And so what we'll do is we'll make sure that we include a link as well to the larger survey series. So it's just kind of a one-click option. You can view those at your convenience.
Right, absolutely. Yeah. And we would encourage you that, when we do our next survey, when we send out more information about this, share this with other people. The wider we're able to spread the net, the more impact that we're able to have. And the more noise we make, the more likely we are to experience change.
I would absolutely echo what Shoshana said, and that tool that we dropped into the chat about filing an insurance complaint, a patient can do that, so can a provider. If your doctor is really struggling with a certain insurer in your state and comments to you, well, gee, gosh, it's you and everybody else I see who's getting pushback on this, I would encourage them to consider filing an official complaint. That goes, to the health insurance commissioner, and then they can be your advocate, and they have a much larger bullhorn. So as always, if you decide to file a complaint, please be in touch with us. We would like to help guide you through this process and help you get some eventual treatment. So please be in touch.
Absolutely. Thank you so much. And I think if we don't have any other questions, then that is a wrap for today. But we do want to thank you for coming today. We really appreciate it. We can't do this without every single person that's here. So we really appreciate that you showed up, and we ask you just to continue sharing this information. Actually, we did have one final quick question. So maybe we can address this. Amanda's asking, what about Medicare? So the big question, a lot of people believe mistakenly that if you're on Medicare or Medicaid, that you can't access some of these new medications at all, let alone step therapy. It's actually not true, and that Medicare does have, same as everything else, their step therapy process. But I'm sure you know more about this than I do, Lindsay. I just want to add that Medicare is not just a simple term. There's straight Medicare, there's Medicare supplement, there's Medigap, then there's Medicare Advantage, and then every plan across states is slightly different, right?
Yeah, well, the short answer is that Medicare absolutely utilizes some of these protocols. So that's the bad news. The good news is that I don't think it's as egregious as it can be with commercial payers. We're getting a bunch of questions in now.
It's obviously a hot topic, definitely a hot topic.
Jonathan has a question about compounding and no appeal process. I believe that's probably true, unfortunately, Jonathan, but if others have comments on that, please add that into the chat. I'll
just say to that I do get a compounding medication for migraine, and I've never been able to get Medicare to cover it, but that could just be me.
Yeah. Another attendee, can you repeat where we can view the other parts of the series? We will absolutely share. Maybe Elise or another colleague can drop in the HMPF YouTube channel link, but we'll share that as well after the webinar when we send out the recording.
And then someone else mentions they find handling original Medicare maddening. Yes. I know Lindsay wants to say something about that too.
Oh, we're here for you. We've had discussions with CMS about combination therapy issues and trying to help them understand that it's in fact a waste of taxpayer dollars to not provide coverage of combination therapy in some cases, because if again, going back to that ER question and how much it costs when you don't. So yes, we're shoulder to shoulder with you on that one.
Yeah, absolutely. Definitely. We definitely are working. There's a reason why we're working together to bring about change. It's very exciting when advocacy organizations partner together, because every advocacy organization has its strengths and areas that it's not so strong on. So when it comes to policies and language and terminology, that is absolutely Lindsay's forte. It is not mine. It just makes my migraine brain hurt when it comes to reaching the patients and getting the word and the message out and starting to mobilize them. That's something that my organization is very good at. And I think this is a great example of a fabulous partnership where we're working together for change.
Agree with you on that, Shoshana. You're the bullhorn.
No, absolutely not.
All right, Wendy, we'll circle with us offline about, we would like to include parts of the webinar in your article for migraine again. That would absolutely be acceptable. We hope everyone on this call will amplify the information that they learned today. And as Shoshana mentioned, the actual report will live on our website. We'll link to that. There will be, you know, a nicely graphically laid out survey report, so it's not just a slide deck. So we hope that you'll share that far and wide.
Right, absolutely, definitely. Again, thank you so much, everybody, for joining us. We look forward to seeing you at our future webinars and events. And if you have any other questions, please feel free to email either Lindsay or myself or both of us.
Thank you again. Take care.
Have a great day.